There was a documentary that aired this week on ADHD and this being a social construct, and there were questions about whether ADHD was a myth. There were also concerns about children taking medication for ADHD treatment and it being referred to as children were taking mind altering drugs. We're aware of the different responses that have arisen following this documentary and how different sectors have felt. Parents have expressed worries, there have been anger from professionals, and it's left some parents with questions about whether they took the right decision to put their child on medication, whether this is something they shouldn't have done. And for those who are still yet to go for the ADHD assessment, there might be questions about whether you want to still go forward for this assessment or your child to go forward for it. So I want to address some of these concerns and worries because they are concerns that they're rightfully things you should be worried about. The first thing is that ADHD is not a myth and it's not a social construct. We've known about ADHD for so many years. It's one of the most researched conditions in child psychiatry. There have been lots of scientific research, peer reviewed research, which has shown that ADHD is a real condition, it's a neurodevelopmental disorder. We know of risk factors that predispose to ADHD, and we see this. I think one thing that was quite concerning about the program was that none of the clinicians that were there was a neurodevelopmental pediatrician. This is concerning because neurodevelopmental pediatricians are the ones that actually see children from very young till about 18. So they know the children and they follow them up. They know about the risk factors. And we are used to assessing children's development. We know patterns of um, development in children. So, to determine whether your child had a proper or a comprehensive assessment, it's important to be aware of what makes a good ADHD assessment. This is really important because we are aware that there are places that don't do assessments as well as it should be. We have the NICE guidelines, which is the National Institute of Clinical Excellence guidelines on ADHD, which guides the conduct of assessments of ADHD and puts forward the standards as expected to call it a proper ADHD assessment. That assessment should go through the child's birth history, developmental history, should look at risk factors that would have predisposed to any difficulties at birth, including developmental concerns. Should look at post-birth period, if your child needed any resuscitation at birth. Should look at the development and when this behavior started. The assessment should also have a clinical examination. The assessment should consider whether there are alternative causes for the explanation of those behaviors, and that should be clear that that was being done. The assessment also collects information from different settings, including schools and other settings where the child is in. The clinician would have done a clinical examination as well. So these are things to watch out for when you're going for an assessment. Is your child having a robust assessment like this? In terms of diagnosis, the clinician usually considers all the information they've gotten and decide after reviewing it to see whether your child's patterns of behavior meets the standards that's expected in an ADHD assessment. If your child's diagnosed with ADHD, most clinicians will not start medication straight away. They will direct you to attend a parent training class or course, which will teach you about how to support your child or young person with ADHD. The schools get information about how to support your child in school. We then review your child, possibly about 6 months after, to see whether he's made progress. If your child's making progress on behavioral management, they're discharged. If things have not improved, then we think about medication. So medication is not usually started first line. And there's a discussion with you, your child, to look at what is the best option for your child. And when medication is started, your child is being monitored. So if there was any problem about your child's personality changing or any concerns of that nature, your clinician will notice and you will discuss with your clinician and they will make changes to the medication. Children with ADHD are usually not left alone. They are monitored, and that's why we we make sure that the parameters are normal and there is no deterioration in mood and the growth is going well. We've seen people who've been on ADHD medication for so many years, there's been no impact on their cognition, they've continued to do well, and many young people with ADHD who have gone on their treatment and stayed on their treatment because they needed it, there has been no indication that that has been detrimental to them. So, medication is part of an ADHD treatment plan. It is not the main treatment, and we do not use it as first line. So, we want to stress that if you're concerned, discuss with your doctor. Don't just stop medication abruptly. And if you were going to go for an assessment for ADHD or your child was going to go for an assessment for ADHD, please go and see your doctor. You shouldn't stop medication or stop the process of your assessment based on the recent documentary. If you have any comments or any worries, please see your doctor. And if you want to clarify any of the information we have put out, you can send a message to us. Please note that this does not classify as medical advice, but is an educational advice following the recent video that was released. Thank you.